Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share. Do you know what phimosis is? It's a medical term that you might not hear every day. Simply put, phimosis is a condition that affects males. It's when the foreskin, the sheath of skin that covers the head of the penis, cannot be fully pulled back or retracted. This might sound daunting, but it's important to understand that phimosis can occur naturally in newborns and young boys, or it can develop later in life due to infection, inflammation, or scarring. Ever wondered what causes phimosis? Well, let's unravel this mystery together. Phimosis can be caused by a range of factors, with some individuals being born with it. Yes, congenital issues can lead to a tight foreskin that's difficult to retract. Now let's talk about balanitis. This is an inflammation of the foreskin and the head of the penis, often caused by poor hygiene or infections. It can lead to scarring, which in turn can cause phimosis. In a similar vein, balanitis xerotica obliterans, a rare and chronic skin condition, can also result in phimosis. Another cause, though less common, is forced retraction of the foreskin. This can cause microtears, leading to scarring and, you guessed it, phimosis. And here's something to note. Phimosis is more common in uncircumcised males, so circumcision status does play a role. Remember, phimosis can develop at any age and it's not always preventable. How can one identify the signs and symptoms of phimosis? Well, it's important to be aware of several key indicators. For instance, one of the earliest signs is difficulty or discomfort during urination. This can progress to pain or a burning sensation, which should never be ignored. Inflammation of the penis, particularly the foreskin, is another sign. This swelling can be accompanied by redness, warmth, and tenderness. You might also notice a whitish or yellowish discharge. Painful erections can also occur. This is due to the inability of the foreskin to retract fully, causing tension and discomfort during an erection. These symptoms can be distressing, but remember, a diagnosis of phimosis is typically straightforward. A doctor can usually diagnose the condition through a simple physical examination, so there's no need for invasive tests or procedures. If you're experiencing these symptoms, it's crucial to seek medical attention immediately. Prompt diagnosis and treatment can prevent complications and ensure a swift return to health. What does the treatment of phimosis involve, and what complications can occur if it's left untreated? Let's dive into this. Treatment options for phimosis are usually based on the severity of the condition and the patient's comfort. In mild cases, doctors may recommend a conservative approach, which includes gentle stretching exercises and the application of topical steroid creams. These creams help to soften the foreskin, making it easier to retract. In more severe cases, or when conservative treatments fail, surgical options may be considered. Circumcision is one such option, where the entire foreskin is removed. Another option is prepudioplasty, a less invasive procedure that involves making a small incision in the foreskin to allow it to retract more easily. Now let's talk about potential complications. If left untreated, phimosis can lead to a range of issues. For starters, it can cause urinary tract infections due to the difficulty in maintaining proper hygiene. It can also make intercourse painful. In the long term, there's an increased risk of penile cancer, though this is relatively rare. It's important to note that while these complications sound daunting, they're not a guaranteed outcome of phimosis. However, they underscore the importance of seeking medical advice if you suspect you or someone you know may have this condition. While phimosis can be a serious condition, with proper treatment it's completely manageable, so don't worry, help is always available. Can phimosis be prevented, and what have we learned today? Well, phimosis can indeed be mitigated. General preventative measures include maintaining good hygiene and avoiding forced retraction of the foreskin. Gentle cleaning under the foreskin, starting from an appropriate age, can help prevent infection and subsequent scarring that could lead to phimosis. Now let's summarize what we've covered today. Phimosis is a condition where the foreskin cannot be fully retracted over the head of the penis. It can be caused by infections, inflammation, or scarring. Signs and symptoms include difficulty urinating, painful erections, or an inability to fully retract the foreskin. Diagnosis typically involves a physical examination, and treatment can range from topical steroid creams to surgical procedures. Complications of untreated phimosis can be serious, including urinary tract infections and an increased risk of penile cancer. Remember, if you or someone you know is experiencing symptoms of phimosis, don't hesitate to seek medical help. Stay informed, stay healthy. UMCC, your ultimate medical consultant connectors.